My name is Adrienne Shum, and I am a research assistant at the University of Oxford. I'm working on the co-space study, which is led by Professor Kathy Creswell and Dr. Polly Waite. As we all know, COVID-19 has caused major disruptions to family lives through social distancing, school closures, and lockdowns. Our study aims to track how children's mental health has changed during the pandemic. And since March last year, we've been collecting monthly data from parents and carers of children aged 4 to 16, as well as self-reported data from adolescents themselves. In this sharing, I'll spend a bit of time talking about what our study involves and our initial findings in the first lockdown, and then I'll share some of our more recent findings in relation to children's mental health. Before I proceed, I wanted to highlight that this is not a representative survey from the United Kingdom, so it's biased and it's self-selected. So it's important not to draw conclusions about the prevalence of the problems from this study, but it is useful and it gives us an indication of how things may have changed over time. Our study is quite big, so we looked at quite a few different measures, but in this sharing I'll be focusing on the outcomes from the SDQ, which we looked at the symptoms of behavioral, emotional, and attentional difficulties. So whenever I'm referring to children's mental health, I'm talking about that. So let's me walk you through our initial findings from the first lockdown. Over a 1 month period early in lockdown, according to Parents and Carers report, for emotional difficulties, such as consistent low mood and behavioral difficulties, such as temper tantrums, there was an increase for primary school-age children, but not for secondary school-age children. For restless and attentional difficulties, both children and older adolescents reported an increase. So these graphs really highlighted that over the course of lockdown, there were increases for primary school-age children in terms of mental health difficulties, but older children seem to be doing relatively better. One of the factors that might account for the age differences in our sample might be related to communication with peers during the lockdown. So among our sample, as you can see, the vast majority of the secondary school age children in blue were having regular interactions with their peers because they were able to do so using their screens. So this could be through social media, texting, or gaming. But for younger children, they weren't able to do this and they weren't able to connect with their peers. So you can see only about a third of primary school age children were regularly communicating with friends. So looking at the data, it seems to suggest that screens might provide the opportunity to connect with other young people, and this could be a protective factor of deteriorating mental health during the first lockdown. But having said that, when it comes to screens and social media, so much of it is about what you're doing on the platform and whether it's a positive experience or not. So this is something we're still looking at. And of course, the data that I just showed you in the previous line graphs, it's based on means. So it's about pulling together the data across the whole group and looking at the average. So what it doesn't capture is the variation in individual experiences and identifying who's been struggling more and who's been healthier on average. So in this graph, we also looked at different trajectory of change in symptoms over time in the first lockdown. And what you can see here is the level of hyperactivity and attention symptoms divided into 3 groups. There's a group here in red at the very bottom for children who had low levels of difficulties at the beginning and continue to have low levels all the way throughout. And opposite, on top, there's also a group here with high levels of symptom difficulties at the very beginning, and that's existed all the way throughout the lockdown. And lastly, in the middle, there's another group in blue here who actually were not struggling particularly at the beginning, but we saw a marked increase as things went on over the course of that lockdown. So who are these people and how are they different from each other? We found that those who are in blue and green lines were more likely to be boys below the poverty line, of younger age has a special educational needs or neurodevelopmental condition. And we also found that other family factors associated to these two groups were that they had higher levels of stress from parents, as in the parents have higher levels of stress. There were more conflict between parent and child, and there was also a lower level of baseline warmth. Here we're looking at the same trajectory graphs but for conduct problems, and you can see that there are 4 types of trajectories, but for those who struggled more at some point of the lockdown were more likely to be again from lower income families and special educational needs. And lastly, with emotional problems, we have a few more different trajectories. But all in all, groups who struggled more at different points of the pandemic were again more likely to be from families of a lower household income, special educational needs, and the same type of family factors. So these 3 trajectory graphs highlight that there are consistent factors that are associated with more problems at some point during the pandemic. Fast forward, in April we looked at the change in children's mental health from March last year to March this year. Similarly to the first graphs I showed you, we looked at the changes in symptoms of behavioral, emotional, and attentional difficulties. In this graph, you can see the changes in scores for these 3 subscales resemble pretty much a similar pattern, so increasing in the first lockdown and decreasing as lockdown eases in June, July. It was stable throughout the summer in 2020, but peaked again in the recent lockdown. So the graph I just showed you highlights 2 important findings, and the first one is that on average, there has been a sharp decrease in all 3 subscales among children as restrictions have eased since February this year. And then second, children and young people experienced highest level of mental health issues in June 2020 and February this year. So that's when restrictions were most stringent. So overall, these graphs show you that the highest level of mental health issues were reported during the time when restrictions were highest, and then the average mental health difficulties decreased as schools reopened and restrictions eased. And this pattern seemed to be the case for both the first lockdown and the recent lockdown. Looking at the differences between child age group, we see that on average primary school age children had greater changes in levels of mental health difficulties compared to secondary school age children, which means that on average levels of mental health difficulties were more or less stable for older kids. In this particular report, we also looked at the self-reported data, and we found that adolescent self-reported levels were more or less in line with parental reports, so mental health difficulties were on average relatively stable throughout the year. Overall, children have experienced reductions in mental health symptoms as restrictions eased, but having said that, children with special educational needs or neurodevelopmental disorder and those from lower income households have continued to show elevated mental health symptoms throughout the whole pandemic, as you can see in this graph. So these findings make it clear that children's mental health has been negatively affected over the course of the pandemic. And moving forward, it really is important to prioritize their well-being and, in particular, identify those who continue to experience significant difficulties and really require further urgent support. So I'll finish here and summarize 3 key messages. So first of all, while variable, there is increasing evidence for an overall negative impact of COVID on children's mental health. Second, the study also highlighted that the unequal impacts of the pandemic on specific groups of children and young people, such as those with special educational needs and children living in families on low income. Last but not least, the critical question is what's happening now as schools have reopened, and it will be essential that we continue to track how children are doing and ensure that children and young people have the best opportunity to bounce back from the challenges over the course of the pandemic. I will stop here, and thanks very much again for having me, and thank you so much for listening.